Hello everyone, I'm Dr. Nicholas Haddad. I'm an infectious disease specialist and I work for CMU Health in Saginaw, Michigan. So COVID-19 is a virus that took the earth by storm. There's a lot of facts we do not yet know about the virus, and we're learning by the day. One of the anxieties we all have is how to go back to normal. And it's hard to predict the answer to this question, but from what we can improvise, we believe that transitioning to normal will be in phases. It will not be a flick of a switch. It will be a slow transition back, and I believe a lot of it has to do with being careful. So masks will be with us for a while. And when we have a significant decrease in the transmission, we can start easing off on using masks. Luckily, we live in an area that's not highly congested, so less people than in larger cities, but that should not make us feel that relaxed. And we need to follow the recommendations by the authorities, which will lax this very gradually into steps from very tight control to lesser control as we ease off the lockdown. And we always need to be worried about another wave. We don't know that it'll happen. We believe it might. We don't know if it does happen, how severe it will be. So a lot of unanswered questions. But our role as good citizens is to prevent transmission as much as possible. That's how we need to think about it. And that's why we need to comply with what the health officials tell us, because they know what's best for everybody. It's not just me anymore, it's the community. I believe that ultimately we are going to emerge from a pandemic, and this is based on historical examples. We have had pandemics before. The human race ultimately prevails. Unfortunately, the price may be high, so let's hope for the least amount of casualties, least amount of mortality, and not only hope but work for it by being vigilant, by following infection control principles, which we've discussed, and by always reporting severe symptoms and staying at home if you're not that ill.